Well, our next presenter, we have a really wonderful partner of ours that we've been able to do a lot of work with. And it is John Biggert from the Montana Brain Injury Alliance. So I hope you all have a chance to visit with, because he has packed full of resources. He's going to tell you about some of those today. And John, I have a little bio here I'll read so people get to know you better. So John is a native Montanan and has worked as the executive director for the Brain Injury Alliance of Montana. Having worked in the nonprofit sector since 2010, John specializes in working with individuals, their family members, and healthcare professionals in Montana to help create a better future for brain injury survivors. In his free time, John spends time outdoors with his family and is the mayor of the town he lives in.
So I don't have anything on the screen, but I was thinking just because you're giving your eyes a rest, that doesn't mean it's nap time, okay? I had this theory that if I did really tiny print up there that you guys would all move closer, but the team from Benefice in their presentation this morning proved that that wasn't correct. I'm just going to pull this up real quick to make sure it's big enough that I can actually read it. So I'm going to actually, nothing on the screen, no. Is that okay? Okay, thank you. I'm going to visit today about a new stroke program that we recently started that is really excited, but before I get into that, I was hoping to share a little bit about the Brain Injury Alliance in Montana, why we do what we do, who we are, and what we do. Most people don't realize it, but Montana toggles between second and third in the nation per capita for traumatic brain injury-related deaths. In addition to those that unfortunately don't survive, there's a lot of folks that, a significant prevalence of individuals within the state that are living with brain injuries. And I often joke about how here in Montana that we work hard and we play hard, and I think anybody that lives here understands that's the truth, and unfortunately there are consequences to that. In spite of the fact that we're second and third in the nation per capita for TBI-related deaths, unfortunately Montana is one of only 2 states in the nation that don't actually receive state-supported funding for brain injury resources, resource facilitation services. So that's a little bit frustrating. Something that we've been trying to change for a long time, and we're working on that. In the work that I've done, I've quickly realized that people don't wake up in the morning and think, geez, I'm going to start planning and prepping in case I have a brain injury today. People just don't do that. And me seeing what I've seen now and gone through it kind of surprises me, because, boy, if they did, it would probably make things a lot easier in the long term. We all know, all of us here that have worked with individuals with brain injuries, that it absolutely turns their lives upside down. And not just their lives, but their lives of their family members, their friends, anybody that's close to them. It creates very significant challenges and things that are difficult. I broke my leg twice, actually in the same spot, which is kind of a weird coincidence. But when I broke my leg and I went to the doctor and they did surgery, they put in hardware, there was a pretty clear plan of what that recovery would look like. They were able to tell me, we're going to put this hardware in, it's going to hurt, you're going to take some pain meds for a couple days, you're going to be on crutches for this many days, probably walk with a cane for so many days after that. And then after that, you're going to be bouncing around and you'll probably be running and you might have a little bit of long-term pain, but you'll probably recover pretty well. Unfortunately, no matter how wonderful our acute care is in Montana, across the country, and throughout the world, and how amazing work they do when individuals have brain injuries, they just don't have a good roadmap for an invisible injury. So what happens is like you spoke about earlier, about if you've seen one stroke, you've seen one stroke. We talk about that a lot with brain injuries as a whole, and that creates huge challenges for individuals that are going through that. It also creates big challenges with their healthcare team. The Brain Injury Alliance of Montana is a statewide nonprofit. Our mission is to help individuals that are impacted by brain injury, and we do that in a lot of different ways. We do resource facilitation, we do advocacy at the state level, even federal level. We do a lot of work with prevention and awareness. We're pretty well known for our youth-free helmet giveaways that we do throughout the state, kind of my favorite part of the job. One of our biggest programs that we provide is called the Brain Injury Helpline, and it's a free service that anybody that is impacted by a brain injury doesn't matter, all ages, all types of injuries. Could be someone that, had a brain injury over the weekend, or a veteran that had one maybe 20 years ago. They can call this telephone number and they can speak with somebody at the Alliance, and they can provide resources that will just help connect the dots with what's going on. And just a lot of times connecting those dots to the resources that are available it's just very difficult for people, because when they leave those acute care settings, a lot of times they just get great instruction on what's going to happen when they get home, but they don't always understand what the long-term issues are going to be and the challenges that they're going to deal with that. So obviously connecting those dots, sometimes we do it with internal resources. We've also got community resources. There's national resources, state resources, and a lot of stuff that are online. And what it does is it kind of helps some people that are going to have a new normal. It kind of helps them with just dealing with that and getting better. So moving forward to what we came here to talk about, I guess I was going to ask a survey, kind of probably do it the old-fashioned way, but how many people here throughout some point in their life have had peer support? Can you raise your hand? Any type of peer support. I'm assuming the people online are probably all raising their hands right now. How many here believe that positive peer support, it can be life-changing for individuals? I mean, I firmly believe that myself. So we operate, we work closely with traumatic brain injury and brain injury support groups across the state. There's a lot of them that are in-person support groups, and we actually operate a statewide virtual support group. It's called the Montana Puzzle Club. It's called the Puzzle Club not because they get together and they do puzzles, but because when you have a brain injury, a lot of times your life's shattered into a lot of different pieces, and this is a group that provides peer support to help put those pieces back together. So over the years, we have heard over and over again, in fact, last year when I spoke, we talked about, is a stroke a brain injury? And fortunately, I haven't had that question quite as much in the last year, so I'm hoping people are finally coming around to understanding that a stroke is absolutely a brain injury. But we've had a lot of people that have said, although a lot of the challenges and deficits and things that can come with a traumatic brain injury, sometimes there's differences between that and what individuals with strokes are dealing with. So they've asked us to put together more of a peer support type program for stroke survivors. And so in a partnership with the Mission Lifeline Group, we came up with the Montana Stroke Survivor Connections program. And it's the only program in the state of Montana that does this, but it's not the only program in the country, and there's some other wonderful programs that we're actually able to model the program after. And so what this is, it's a free program to individuals, and what it does is it actually takes a long-term stroke survivor, somebody that's gone through it, somebody that's doing well, they got a pretty good understanding of what the challenges were that they went through, and it pairs them up with a recent stroke survivor whose life is upside down and they're really confused and they're not exactly sure what things are going to look like for their future. So what we do is we seek volunteers that are the long-term stroke survivors, and we contact them, they contact us, we make that connection, and then we provide them with training. And that training actually just sets them up so that they can make phone calls with the more recent stroke survivors and provide that peer mentorship. And it teaches them kind of things you should say, shouldn't say, just positive outcomes within those conversations. And so they initiate that phone call. We've got, as of now, we've had about 57 survivors across the state that have actually participated in this. And to me, that's just super exciting for us. We've just kicked off the program at the start of the year, so it's only increasing. As of now, we've got about 10 volunteers. 8 of them have actually completed the training. Quick plug, if you know people, if you know recent survivors or long-term survivors that would like to be a part of this program, we would just absolutely very much appreciate more people to be involved in that. In fact, there's a training, I was visiting with someone earlier today about it. It's called Certified Brain Injury Specialists, and we did this training earlier in the year, and we actually had 2 long-term stroke survivors that are currently physical therapists now, and they actually signed up to be volunteer long-term stroke survivors to be peer mentors for the other folks, and I thought that was really exciting. As the folks from Stroke Onward mentioned, any type of brain injury, any type of deficit with that creates that emotional journey. And to me, it's just like, I feel like with the majority of the phone calls that I take and my staff takes, it's an emotional conversation. It always is. And a lot of the people just want to be heard. And so we truly felt like that this peer support has been something that has been a long time coming, much needed, and we're super excited that it's available. To kind of give you an idea, one of the calls, it was one of the first calls, and I think I actually shared this with Joni, but we had a peer support Montana Stroke Survivor Connection phone call that was initiated, and we had the longtime stroke survivor was actually a younger person, somebody that was in their 20s, and they were visiting with someone that was a little bit older, probably in their 40s or 50s, I don't recall for sure, and it was really interesting because it was about a 45-minute phone call, and the phone call started out, and this more recent stroke survivor, the person that was a little bit older, was very defensive. They were just, what the heck are you going to teach me? You're young, your body's younger, you recover from things like this quicker, faster than I would be able to, and what are you going to understand? We're from two totally different worlds. And that's how the call started, and I kind of just sat back and I listened to it, and by the conversation, by the time it was done, they were both laughing, they were crying, they were just friends. I mean, if they would have been right next to each other, I'm sure they would have given each other the biggest hugs they could. And it was just really exciting. And these two people have made regular contact throughout this program, and they've just become very close and just very helpful to each other. So that's been a wonderful thing. Ways that we're getting the program out there is we've got participation with hospitals. So when hospitals are releasing somebody that's had a stroke, they actually are providing them with information. In fact, I did put information, I hope I got everybody's seat, about the program. There's just a couple different flyers in there, a little poster. There's actually a hard copy sign-up sheet. We have a separate sign-up sheet for the stroke volunteers, so the peer mentors, and all of this information is available on our website as well. And so the big thing behind that is we just ask you, because this is a free program and it's so important and it's so helpful with these folks that are going through these challenges and these difficult journeys, is just to help spread the word and just help reach, share this information with others. And we've got it all over our Facebook page, and we're just excited to help this program grow. So one of the things that's actually came out of this program, which is really exciting, and we probably should have seen it coming, but we were kind of surprised at how hard it actually hit us, is that as we were out meeting with people and visiting with people, we had people that said, what about the caregivers? What about the stroke survivor caregivers? And so, and my heart just goes out to caregivers. I have conversations with them constantly that just are uplifting, and sometimes they'll just bring you down, and they're just really painful because of the challenges that they have to go through. And so we haven't kicked it off quite yet. We're still kind of in the finalizing the stages of that, but we're actually going to do kind of a partner program that'll be called Montana Stroke Caregivers Connections. So what we'll do with that is we'll match up a longtime stroke caregiver with a more recent stroke caregiver so that they can have those phone conversations and get that peer mentorship to help them through those journeys that they're going through. And that's kind of the program in a nutshell. And I don't know how much time I took. I just was winging it. So if you have any questions, please let me know.
Hi, it was nice to meet you earlier. I was just wondering, I know there are organizations like Neuro Restorative. Do you work with any organizations that provide board and care homes or long-term housing for patients that don't have a family member or maybe are not able to return home?
Yeah, we absolutely do. Well, this one's louder. Unfortunately, in the state of Montana, we're limited on resources for what type of housing is available. We've got a wonderful place called Liberty Place that's not far from here. They've got a couple different facilities, and they've got it's a long-term care facility that has a specific approach of bringing in people that do have brain injuries. And other than that, we've got some other great long-term care facilities, whether it's someone that's staying long-term, or they're just going there for just rehabilitation until they can get better. But we got some great locations. The Rehab Hospital in Montana, I was over there visiting with them, and I know that's more short-term, but they're just an amazing organization, and there's tons of places like that throughout the state. Yeah, absolutely. So our website is www.biamt.org, and it should be on that literature that I gave you on your tables too. And please feel free. I'll be around the rest of the day. Unfortunately, I can't be here tomorrow. We're a small nonprofit, so I've got an important fundraising meeting tomorrow that I have to get my butt to, so I won't be here then. But thank you very much, everyone, and thanks for all the good work you do.